How are you doing tonight?
I'm fine.
You're fine?
Yes.
So looks like you're here for the 6:30 p.m. appointment, right?
Yes.
Can you please tell me your date of birth one more time?
December 1st, 1999.
Okay, perfect. So what brings you here?
I have some cramps.
You have abdominal cramping?
Yes.
Okay, so since when?
I don't know,
How many days?
3-4 days.
3-4 days?
Yes.
Okay. Any other symptoms?
No.
No?
No.
Do you have any rashes or lesions?
No.
Have you lost any weight recently?
Yes.
You did?
Yes.
Do you know how many pounds?
10 pounds.
10 pounds?
Yes.
Since when? Or
1 year.
okay, so in 1 year you
Yes.
lost 10 pounds.
Yes.
Are you? It's stress related?
Yes.
Or you're stressed?
Yes.
Any recent fevers?
No.
No. Are you taking any medications right now?
No.
Antibiotics?
No.
So no.
No.
Any recent travels?
Yes.
You did?
Yes. To Paris.
To Paris?
Yes.
How was Paris?
Very good.
Okay, so how long did you stay?
1 week.
1 week. Awesome. Any allergies?
No.
Okay, perfect. So, any pain on your abdominal areas?
Here.
So, a little bit on the right side.
Yes.
So, a little bit of pain and cramping. Any other symptoms?
No.
Did you change your diet or did you eat something that you don't usually eat?
No. No.
No?
No.
And do you have more cramps before your period?
Yes. Yes.
And pain?
Sometimes, yes.
Okay. So I will check your abdomen. I will take your vital signs first. I will take a look a little bit at your face, at your eyes.
Okay.
And then I will check your belly, okay?
Okay.
So would you mind if you stand up so I can take the vital signs?
Okay.
Thank you. Okay, so I'm gonna put my gloves on and I will start by taking your temperature to make sure you don't have a fever. It's 37.3. That's okay so far. And it is okay if I listen to your heart and lungs. So if that's okay with you, I want to listen to your heart and lungs.
Yes.
To make sure everything is all right. Okay. Can you take a deep breath in now and release? listen to your pulse as well. Take a deep breath in now. Hold and release. And I'm going to do the same thing here. Breathe normally, please. And now take a deep breath in. Hold and release. Okay, that's great. So normal rhythm of the heart. And I heard just S1 and S2, no S3 or S4, and no murmurs, and that's great. And I would like to check your chest a little bit right here, and I will palpate if that's okay.
Yes.
Do you have any pain?
No.
Any thyroid problems?
No.
Just wanna make sure I don't feel any masses or any lumps. Okay, great. So I'm going to check your jawline. You don't have any swollen lymph nodes, and that's great. You can relax your head. Going to check here a little bit and around your ears. Okay, Andrea. So far, so good. I'm going to check your eyes now. So I'm going to come very close to your eye and I'm gonna touch your lid. Is that okay?
Okay.
So you can relax. I'm just going to push it down. I'm going to take the eye light. I'm just checking for anemia, so everything is good. Let me check here. Good, so I'm going to lift it up a little bit. I'm checking for jaundice. Perfect. Great. So you have beautiful green eyes.
Thanks.
Just keep looking straight at my nose. Can you follow the pen light with your eyes only, please? Okay, that's great. I also want to check inside your mouth. So can you please open your mouth and stick your tongue and say Good. So everything is pink, moist. I don't see any inflammation. Good. You can relax. Let me see how are the gums and teeth. You're in pretty good condition. Good. So I'm going to check your ears and then we're going to move to the abdominal part, okay? Any problems with the hearing, with the...
No.
No?
No.
If any pain?
No.
So just turn your head a little bit this way. Tympanoid membrane looks great. I don't see any redness. No inflammation. Okay, can you turn your head more so I can check this side? It's the same, you have just a little bit of wax, but otherwise everything is normal. So let me just tap on your face to make sure I'm not missing anything, and then you can lay down, okay?
Okay.
Good. So you can lay down now. Okay, Andrea, so I'm going to check the appearance of your belly first. So your abdomen looks flat and smooth. So checking from this side, from here. Belly button is right centered. I don't see any skin irritation, no redness around. So, so far looks good. I'm going to palpate. First, you said you have some pain sometimes on the right side.
Yes.
Do you have the pain now?
Yes, here.
Okay, so here, around here is the liver. Good, so I'm gonna start with a light palpation,
Okay.
and then I'm gonna do a deeper palpation.
Okay.
So let me know if you feel any pain or if it's too much, okay?
Okay.
But I do like the skin. I don't see any discoloration of the skin, no rashes, and no lesions. Also checking for any masses or lumps. Any tenderness.
No.
Let me know if you feel anything abnormal. So I do feel a little bit of tenderness on the right side. If I do a deeper palpation on your ovary, does it hurt now?
Yes.
Yes?
Mm-hmm.
Good. Does it hurt now?
Yes.
Does it hurt now?
Yes.
What about here?
No. 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 No.
Good. So I think it's best to order an ultrasound to check your ovaries as well, and we also have to check your liver functions as well. So I don't see any inflammation or redness. Okay, so I'm gonna start to listen your bowel and all the 4 quadrants. Hear some bowel movements. perfectly normal. Can you take a deep breath in now? Release. One more time. Release. One more time. Release. This was a big one, but it's normal. You can breathe normally now. Okay, so I did hear loud gurgling, but normal sounds of the bowel so far. Good. So I'm going to start to percuss. Any sensitivity?
Here.
Okay. Also checking the thoracic cage. That looks fine. So here should be the liver. You said you do have some pain when I'm pressing
Yes.
down. So I'm going to try to check your kidneys as well. Any pain?
No.
Okay. So far, abdomen it's flat, soft, it's symmetrical. I didn't feel any swelling, but I did feel some tenderness here. So I think it's best to order an ultrasound. There's no discoloration of the skin. Skin is intact, no rashes, so no visible lesions or scars. So I just have to take some measurements now of your belly. Good. Okay. Actually, let's do like this. Four. Good. Yeah, and normal sounds of the bowel. I did hear a lot of gurgling, but that's fine. I checked all the 4 quadrants. Now I would like to check your sensitivity.
Okay.
So tell me, how do you feel this?
Dull.
Do you feel it dull?
Dull.
And how do you feel this?
Sharp.
Okay, so you can close your eyes if you want and tell me.
Sharp. Dull. Sharp. Dull. 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 Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. 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 Sharp.
Okay, that's wonderful. Okay, Andrea, I also want to check your sensitivity to warm or cold. So tell me, how do you tell me, how do you feel this?
Cold.
What about this?
Warm. Cold.
How do you feel this?
Mm. 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 Warm.
And what about this?
Cold.
Okay, so it was very cold.
Yes.
Okay, what about now?
Cold.
Now?
Cold.
How do you feel this?
Warm.
This?
Warm.
Let's see one more time.
Cold. Cold.
Good. And do you feel this on the right side or on the left?
Left. Right. Left. Left. Right. Both. Both.
Good. I'm going to use a little bit of oil, so I will try to gently massage, and then I'm also gonna use cupping therapy.
Okay.
So I'm just apply just a small amount of oil, so we'll hydrate the skin. I'm gonna use this roller. It's a little bit cold, but now I'm going to warm it up a little bit. So this will help you relax. Do you feel this warm or cold?
Cold.
It's still cold?
Mm-hmm. Yes.
Good. So I'm gonna check your skin to see how elastic it is, if it's good perfused. It's very soft, shiny. Good. Looks like I'm hungry as well. Do you have any pain on the left side
No.
right now? No. Good. So I'm gonna do it here, and then I'm gonna move to the right side. Any pain or discomfort? Or
No.
it's good?
It's good.
Let me know if you have any pain, actually severe pain.
Okay. Now I have a pain here.
Okay, let's do with this one. Okay. So I'm going to check your feet now to make sure you're not retaining any fluids, and then we're gonna discuss all the findings, okay?
Okay.
So I'm going to check your feet to make sure you're not retaining any fluids, you don't have any edema or indentations. Okay, so far so good. I'm going to check also the temperature, and your feet are a little bit cold,
Yes.
but they have the same temperature. Your skin is a little bit dry though, so as far as I can see, but I don't see any rashes or any eczema. So I'm going to do some toe spreading to make sure you don't have nothing in between the fingers. People usually do have eczema, but this looks very good. So no skin problems at all. Going to check your heels, your pads that look very good, and your color of your nails, they are very appropriate and normal. They are just a little bit cold, but I think it's fine. I'm going to take your pulse. Okay, that's great. Just want to make sure I'm not missing anything. Okay. So let's see, capillary refill. It's within 2 to 3 seconds. Okay, Andrea. So we're gonna discuss the final findings, okay?
Okay.
So like I said before, regarding your abdomen, I didn't find anything abnormal. So a little bit of tenderness on the right side. So I think it's best to have an ultrasound to see your right ovary. And for the liver, I would like to do some blood tests to make sure the liver functions are in normal limits.
Okay.
Otherwise, your eyes and all the other tests that I did and your feet, they look in great condition.
Okay.
So I will give you a referral just for this, for the ultrasound and for the blood test. Do you have any questions, Andrea?
No.
No. So if everything is good, let's schedule another appointment in 1 year, okay?
Okay.
If it's something alarming with the results, then we're gonna see each other in another week, okay?
Okay.
So if you have more pain, just let me know.
Okay.
Thank you so much for allowing me to do this exam, and I will see you next time.
Yes.
Bye-bye.
Bye.